Hello, everyone. Welcome back to the Sunflower Palliative Care Podcast, a podcast exploring all aspects of children's palliative care around the world. We're hoping to bring curiosity, humor, and reflection to the world of palliative care, where we explore joys and challenges of working in this incredible field. Whether you're a nurse, counselor, pharmacist, doctor, or other healthcare provider, or just someone who's interested in learning more about palliative care, then this is the podcast for you. I'm Camara. I'm a nurse practitioner at Canuck Children's Hospice, and I also belong to the Two Worlds Cancer Collaboration, and I'm the host for this episode. I'm so very excited to be joined by Julia Downing. So many of you will have known this name and her amazing work across the globe, but I want you to introduce yourself, Julia. Who are you?
Thank you. It's good to be here. So I'm Julia Downing. I'm the Chief Executive of the International Children's Palliative Care Network. I'm also a professor in palliative care, and I'm a nurse by background. So people sometimes ask, where do I live? And I live sometime in the UK, some in Uganda, and then I travel around the world. So
how long have you been doing this particular work?
So I've been involved with ICPCN since it started, but I've just been working as the chief executive for the last 6 or 7 years.
So we're sitting here in Hyderabad, and if you're hearing horns honking and different sounds in the background, it's because we are trying to find a quiet space, but we're out in the sunshine here in India. And we're here because we're at the Leadership Institute that we are supporting very skilled clinicians who have a vested interest in pediatric palliative care. These are nurses and doctors and counselors who want to improve pediatric palliative care here and in South Asia. This is the second year running. And so this is our first opportunity to meet in person. And we're here with a whole bunch of people across the globe. Maybe you can tell me a little bit about your involvement around promoting this leadership.
Okay, so obviously leadership is really important if we're going to move the field of children's palliative care forward, not just in this region, but around the world. And so ICPCN are very committed to the development of leaders in children's palliative care. So we've been involved. I was here last year for the 2024-25 scholars. I think there was 19 of them. Mm-hmm. And we're back again this year for the 2025-26 scholars, and there's 22 of them. As you said, they're from India, but they're also from countries around. So I think we've got Bhutan, Pakistan, Nepal, Sri Lanka, Bangladesh, Philippines. So it's great to see new, young, emerging leaders in children's palliative care from the region, not just doctors, but nurses and a few kind of program managers. And it's part of a longer project. This is a face-to-face program. We'll be back face-to-face this time next year. In between that, there's online training, there's mentorship, and all of the participants have a project that they are developing and that hopefully they will implement to develop children's palliative care, but also to develop their skills in leadership and how to lead a project, right from developing it, making it doable, achievable, funding, budgeting, all those sort of things. So it's a great program, very interactive, and really we've just been listening this morning to some of the projects that the last year's scholars have undertaken, and it's been really inspiring to hear what they've been doing. A wide range of projects: neonatal palliative care, empowering nurses, developing services, developing pediatric teams, training. I mean, a wide range of projects, but exciting to see that in this short time, with a bit of support and mentorship, they've not only been able to develop services and improve capacity, but they've also grown and developed in their leadership skills. So it's exciting to see where they're going to be in a few years' time, and looking forward to hearing next year from the scholars who've just started.
I mean, I think you presented around sort of the global need for children in palliative care. And maybe you could say a little bit about that, because I think one of the reasons this institute has been helpful for me is that it's almost like we can share the burden, we can share the load in sort of growing it. But you are faced with those numbers, you talk about the great need and you advocate. So yeah, share a little bit about how you do that day in and day out when there is such a need.
Yeah, I mean, there's a great need, and we were talking yesterday at the Leadership Institute about how there's estimated over 21 million children globally that need palliative care, and at least sort of 19 million children and their families don't have access to those services. So we've got a long way to go to improve access and to make sure that all children around the world, regardless of where they live, have access to palliative care. But how in striving to reach there, we almost have to go step by step and advocating for access to children's palliative care, working with the World Health Organization, working with governments, working with other global organizations to make sure that children's palliative care becomes an integral part of care that is provided. So it's really important that we look at this across the regions, globally, across the regions and nationally. How can we increase access? And of course, we're here in India, and even just here in Hyderabad, I think they said there was 12 million or 10 to 12 million people just in this city. So we know here in India, they have a large burden of need for children's palliative care. So how can we support, encourage and empower? I think one of the only ways we can do it is to build leadership capacity, is to empower nurses, doctors, everybody involved to advocate, to go to their hospital managers, to go to their governments, to the districts, wherever their sphere of influence. So yesterday we were talking with them about what is your sphere of influence? What can you do? If each one of us does our bit, then together we will move further forward in increasing access to children's palliative care.
I've really enjoyed the last few days we've had together, and we've talked a lot about nursing, of course, because that's our background.
Yep.
And we know that there are skills and competencies that can be taught, that people can do this. It's not so abstract or so ill-defined that it's nebulous. It's actually very practical skills that can be taught. How do you do that for a workforce? You've worked in so many places. When you think about your work in Africa, how do you get nurses to do this work?
It's a challenge in different ways in different countries. So, in some parts of the world, sadly, nursing is not seen in high regard, and the nurses are not necessarily trained at a high level. They're not necessarily respected, and they're not necessarily empowered. I've worked in many different countries, and you have to recognize where the nurses are at. You can't, if nurses are trained as they are in some countries at secondary school level, then you can't go straight to being a consultant nurse or an advanced practice nurse. So it's about recognizing where the nurses are, helping them to build their capacity. So the clinical skills, the communication skills, all those things that help us as nurses to do our nursing work. But then encouraging, empowering them, helping them to believe in themselves as well. I think that's a key thing for us as nurses. I often hear people say, "Oh, I'm just a nurse." And it's like, don't say just a nurse. You're a nurse and you have amazing skills as nurses. But also to realize that this isn't just for nurses, it's for other health professionals. But many of the skills that we have and we develop in our clinical care are skills that we can go on to use in our advocacy, in our education. How do you communicate challenging news with families, perhaps who don't want to hear the news that you've got? How do you therefore then use those skills to communicate with perhaps ministry officials who don't know what palliative care is and can't see the need? So it's about helping nurses to think about the skills that they have, how they can utilize those skills in many different ways, having that self-belief, and also trying to share and demonstrate that many nurses are working in nurse-run programs, and particularly in low-income countries. Many of the nurses that I've been working with are actually working in rural areas where they're quite isolated and there are no doctors. So empowering them to use their skills to provide palliative care. And we did an evaluation of the nurse prescribing in palliative care in Uganda, where nurses who have done a specialist training are able to prescribe both for adults and children. We did an evaluation of that, and we were able to show that the nurses were competent and were able to, assess, to prescribe, but also that they knew their limits. So when there was a particularly challenging situation, they knew who to call and who to discuss with, because that teamwork is essential. And we know, if you look at the State of the World's nursing report, over 50% of health professionals around the world are nurses. So we know that nurses make up the biggest workforce. So if we're going to reach adults and children, for palliative care around the world, then we need to be empowering and developing the nurses, because that's the only way that we're going to do it.
Thank you so much. I wonder if you could share, you talked a little bit about a story yesterday about changing children's pain.
We'd been doing some work. It was a big multi-country project. It was funded by FET in the UK and the UK government, and we've been doing work in Rwanda, Zambia, Kenya, and Uganda. Part of that work was training on children's palliative care. So we were at a big national referral hospital, and we'd taken an independent evaluator who was from Zimbabwe to evaluate the project. And we were talking to the head nurse and of the children's ward, and the evaluator asked what difference had the training made and pediatric palliative care made, and that this nurse asked us to listen. So we listened.
We stopped talking.
Quiet. We stopped talking. It was quiet. You could probably hear noises like we can hear now of the hustle and bustle around, but that was all we could hear. And the evaluator said, I can't hear anything. And this chief nurse said, no, that's because before we knew about palliative care, our children were screaming and crying in pain. Now we know how to manage their pain and their symptoms. They're no longer screaming and crying. And to me, that is a very powerful example of the difference that we can make. And every time I say, even now, every time I say that, I get goosebumps, because you can just feel the difference. Also, not just that particular nurse went on to say, but also what others have said as well, it's not just the children with palliative care needs. The nurses, and if the health professionals are taught to assess and manage symptoms, they don't just do that for children with palliative care needs. They're, looking at a pain or whatever the symptom might be with all of the children.
Yeah, surgical pain. Procedural pain.
Procedural pain, that's a big thing, not just in palliative care.
Yeah.
So I think the impact of palliative care is great. And I was at a university, and they were talking about their specialist training for doctors. And the cardiologists were saying, we need our doctors to be trained in palliative care early on in this program, because palliative care is making them better doctors. So yes, all the different specialties were kind of arguing the case for us for palliative care. We didn't have to. And I think that's so true because of our approach, how we teach people to communicate.
Yeah, the idea of whole person care, you know, that you're not just your body, you mind and body and spirit. And, I was thinking about the ward that you're talking about where the children were, previously crying and screaming and suffering. And then I think then next of the mothers and the siblings and the fathers that are there witnessing, trying to support. And what's the impact for families?
The impact is great. Yesterday I was talking about some of the things that Dame Cicely Saunders said. I won't get the wording exactly right, but she said how people die remains in the minds of their loved ones. And, if your child is dying in pain, vomiting, in distress, as a parent, as a sibling, as a grandparent, that's what you're going to remember. If your child is dying and they're peaceful, their symptoms are managed, you've enabled them to have the best quality of life right up until they die, then the parents will remember that. It's still hard, but it makes a difference.
Yeah, no, I think absolutely when we care well for children in their living and their dying, it changes bereavement outcomes. It really does.
Yeah.
The layer of seeing your child suffer on weeks and days and years sometimes. It has a detrimental effect on all around.
Yeah. And it's something you'll never forget.
Well, I could talk to you forever, and I will again speak with you, but I wonder if you had any words of wisdom for people that want to enter into doing this work, and maybe particularly nurses. What would you say about, being you were a bedside nurse, you're a leader, you're an advocate, what would you say about this choice of career?
I feel really privileged to have been working in children's palliative care. It isn't always easy, but it's rewarding. And certainly as a nurse, I feel that the difference I can make for the lives of the children and their families is great. I started off just thinking, well, even if it's just one or two families that I can impact, that's one or two families. And then as we grow and our careers change and we move on, and we can have different impact through education. If you'd asked me when I started out in my nursing training what I'd be doing now, 30 years later, I would never have thought about what the variety in my role and the way that we can make a difference in the lives of many people, many families, but also in the lives of other nurses, of other doctors, of other healthcare professionals, because also if we care and provide good palliative care for a child and a family, we remember that as well. And we learn from that. And just being able to try and empower others and hopefully inspire others to work within the field. I would just say go for it. One of the things I was talking about yesterday, we've had a lot of discussion in this last few days around our leadership journeys. And I was talking about taking opportunities and stepping out of our comfort zone. And sometimes moving into children's palliative care might be stepping out of our comfort zone. But if we don't do that, if we don't take that step, then we're never going to move forward. We're never going to see what stepping out of our comfort zone means. I've tried to step out of my comfort zone, and I keep being in positions where I have to step out of my comfort zone. So it's still ongoing, but I'd just say go for it.
Thank you so much. So, Julia, in closing, is there any upcoming events you want to share or initiatives that are going on that we want our listeners to hear about?
So this year, it's the International Children Palliative Care Network's 20th anniversary. We are planning various events, and in particular, we're planning a conference. So in November in Manila, in the Philippines. So it's our 4th international conference. We haven't had one since 2018 because of COVID. So we're excited about coming together, and we just would love for people to come to the conference to share what they're doing, to share what they're hoping to do, because we want to celebrate all that's happened, but we're still recognizing that we've still got a long way to go. We'd love it if people could join us for that. And we're also really interested to hear from individuals stories of the impact children's palliative care has made on the lives of families, but also the impact perhaps from ICPCN on the work of nurses, doctors. How have you been impacted by ICPCN's work over the past 20 years? We hope to showcase different organisations, tell stories, and really try and show some of the work of children's palliative care around the world. So we hope to hear from lots of people.
So we'll put your contact information in the show notes,
yes,
if that's okay.
Yeah.
And I, for one, am hoping to attend. So I'm looking forward to seeing what's being offered.
Yeah, and also if you're not yet a member of ICPCN, please do join. It's free to join. And again, if you go to our website, then you can find the route there to join.
Yeah, and there's so many good things on that website. There's the courses.
Yeah, we've got lots of e-learning courses. I think it's in 16 languages now, some of them, not all of them, and they're free to do as well. Do look on our website and look at the resources that we have.
So thanks for listening to this episode of Sunflower Palliative Care Podcast. Forward to sharing episodes with you. These podcasts grew from the seeds of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration focusing on children's palliative care. We hope to build a world where no child suffers from serious health-related sufferings. To learn more or donate, please visit twoworldscancer.ca. Thanks very much.
Thank you.